This is a small video for undergraduates and postgraduates. At the same time, a message to the junior teachers how to make use of small things like lab reports or X-ray or images for teaching the students for the decision making and analysis. For a change, I'm not going in the usual manner. So in any case, you'll be taking the history, clinical examination, then only you ask for the lab report. Now, I'm creating a clinical scenario where I'm getting the investigation result first, and from that I'm anticipating what all clinical signs I can expect in that patient. So imagine I'm sitting in the emergency department. One of my friends has sent a patient from the periphery. Patient is on the way. I got the WhatsApp message of that image. So this is one important teaching point for the undergraduates. How to send a patient from the periphery to a tertiary level care. A transporting of patient. There are many preparations for a transporting of a patient. Let it be a newborn baby or another patient. One of the most important thing is to inform the reaching hospital, the physician if possible, so that he can get prepared, anticipate. So in the same manner, I got this image, WhatsApp image. So based on that image, I am planning. What all will be his clinical findings? What will be the state at which he will be reaching here? So what all preparations I should be doing, and plans. I can plan based on this just image. So now we'll move on how you analyze the image and consider the possibilities. Now the patient is on the way. You are analyzing this image. For the analysis, you need a detailed film, but you have only two pictures. So this is an MRI. This is an axial cut, the horizontal cut. This is the right side and this is the left side. This is the right, this is the left. This is at the level of the inferior part of the frontal lobe, and immediately below is the orbit and eyeball, and this is at the level of the temporal, right temporal. What you see here you can see a density, clear margins, uniform density, a little bit of another density is there in the anterior part. It's clearly the margins are clear and some diffusion. So this is perilesional edema is the, and what is clear is the mediastinal shift. The third ventricle, this is the thalamus, third ventricle, this is shifted to the right side. And one more image, this is more clear here. A mass uniform density, but a little bit of different densities here. The margins are clear, and what is more obvious here is the lateral ventricle back horn is not seen here, it is compressed. This is the anterior horn of the lateral ventricle, that's again compressed. The mediastinum is shifted. So these are the very important things, because you may not be in a position to 100% diagnose, but you can get prepared, you can anticipate what will be the shape of the patient when he is coming. So possibilities here for this lesion are, it may be an abscess, it can be a cystic type of a tumor, astrocytoma and all, and maybe hydatitis, but this is not typical of a hydatitis. These are all possibilities, but what is so obvious as an emergency physician is this patient with the evidence of the perilesional edema and mediastinal shift. Significant raised intracranial tension is there. So, what all things you can anticipate, and what will be the physical finding? So, what do you anticipate? Very likely that this patient will be in a unstable state. So any moment with the raised ICT with the mediastinal shift, there can be conning. So the respiration, you are not sure whether he will be breathing, already in apnea. So we need to prepare everything for the respiratory support. Second thing, about the circulation. So what do you anticipate with this raised ICT? It can be a hypertension bradycardia situation. And if it is an abscess, there can be features of sepsis, and sometimes he may be in shock also. So what about the sensorium? Very likely that he will be in varying stages of coma, most likely in deeper coma itself. And once you stabilize, sometimes he may be febrile, high-grade fever can be there. So among the vitals, most important respiratory, circulatory, sensorium, temperature. So everything can be altered. So you have to plan for stabilizing the patient. And what other findings you anticipate in the clinical examination? As said, it can be an infection so febrile. And what are the other findings? The features of raised ICT you need to check, and the focal neurological signs. So what are the raised ICT findings which you need to elicit? Two things we have already mentioned. The sensorium is a part of the raised ICT or part of this neurological problem itself. Second thing, raised blood pressure and a bradycardia you can see. And other physical finding, interesting ones, you need to check the fundus of the patient for papilledema. But one thing, papilledema depends. There can be an absence of papilledema because it takes a little more time for the papilledema to evolve. Still, you need to check the fundus. Then one interesting clinical sign you need to elicit is the McEwen sign, the crackpot sign. What will you do? You can do this thing on this side and you can auscultate here. So when there is a raised ICT, it is just like a little bit of separation at the sutures, and it is just like knocking a crackpot, and you can see. So you need to elicit the McEwen sign. You need to go look for the fundus examination. So all these things you can expect because the raised ICT is much. And out of the neurological examination, most important is the evaluation of the pupils. So what is this? Very likely happening is a supratentorial one-sided lesion will push to other side, midline shift. So what is likely to happen? It's a tentorial herniation. The tentorium will push to the other side of the midbrain is pushed to the tentorial margin. So and you can expect the classical description of the Hutchinson's pupil. So the sequential involvement of the pupil, the opposite side pupil will be constricting, dilating, then the same side will be constricting, dilating, finally resulting non-reacting dilated pupils. So pupil examination is so important. All these things are important in head injury, follow-up also. In this case, you need to evaluate the pupils. And of course, the rest of the clinical examination, what you expect, it is just like hemiplegia. You are getting a lesion on the right side, so you get all the findings on the left side. If he is conscious, the speech may or may not be involved, but very likely that he is unconscious. You cannot analyze the speech. And he may be having a seizure on left side, and maybe he is looking to the gaze maybe to this side, left side. And if there is no seizure, he may be having all the features of hemiplegia like and facial palsy on the right side because it's supratentorial lesion. you will get the right side hypoglossal, but it will not be significant because one side only, and the upper limb and lower limb hemiplegia on the left side. So acute situation, what you expect is the hypotonia, upgoing plantar accentuation. So these are the findings you anticipate. So when a patient is here, the other findings. Actually, this was a patient came with a brain abscess, and in that situation, in the general examination, you need to search a little more for focus of infection. In the skin, any other abscess or osteomyelitis or anything, very important is to assess the source of the emboli. Heart examination is so important because from the heart is one of the most common reason for embolization. So auscultate the heart for any structural problems and endocarditis, palpitis, spleen also. So from the heart, in a pediatric age group, one more thing is cyanotic heart disease with abscess. So many reasons for abscess, but it's an eminently treatable thing. You need to put the patient on antibiotics. At the same time, surgery. In this case, it was an abscess. Neurosurgery was done, and this is the result. After neurosurgery, abscess was drained, and you can see a little bit of air here. So this case was just to highlight how you can make use of simple images to teach a related clinical findings, how to analyze the situation for the student.